Hello. It is quite an honor to be here today. I am Deb Gordon. I'm a social worker with the Heart Failure and Transplant team at Hospital University of Pennsylvania. I've been working I've had the good fortune of working with heart families for over 25 years, and I certainly see myself as a patient and family advocate. Today I'll be speaking about overview of resources for our adult population. So Penn Center for Inherited Cardiac Disease, we're certainly an interdisciplinary team, and we provide tools to manage and treat inherited heart conditions. We understand heart disease just does not affect you, but it impacts on the entire family. We do take a family-centered approach to care. So we have incredible experience within the team. The cardiac disease addresses unique needs of the individuals and families with inherited heart conditions. Our mission is to provide the best possible care for both families through genetic testing and some counseling and advanced treatment options. The team is here for you. We understand that your condition, the team is here to help you, and we understand that your specific condition. We're here to empower you and support you through the way. As an academic medical center, Penn offers vital research that allows innovations of today to become treatments of tomorrow. So, tips for emotional well-being. We're not just here to focus on just your heart condition, but all of you, including the physical, social, and psychological well-being. Understanding your diagnosis and future care options is a vital first step to management of your medical condition. Find the right care team for you. It's important for you to feel comfortable expressing yourself and your question and having the opportunity and comfort in asking those detailed questions. Having open discussions regarding your emotional health, how you feel both physically and emotionally. It's often beneficial for referrals for local support groups. I have a colleague who is running a group monthly, and I actually had someone in the room say that they had, it was a beneficial program. And also referrals sometimes for individual counseling can be very helpful. Defining your circle of support, whether it's family, friends, neighbors, or even healthcare providers, may take on a different role in supporting you directly. We are so fortunate to have a wonderful Penn program for mindfulness, and I can share with you I have actually a personal mission to complete their healthcare professional mindfulness program in the near future. Certainly, they're powerful tools for coping and personal growth. Participants learn to reconnect with the sources of the meaning in their lives, to be steady in the most difficult moments and connect with more deeply with what matters to them most. Mindfulness is often recommended as a way to manage your stress level. Focus on the here and now. Just 10 minutes a day can make a world of difference. Quiet reflection, deep breathing, guided imagery may bring relief from stress. Take time to listen to music and relax and try to think of places and feelings that bring you joy. I can share with you, there's wonderful resources that can be downloaded right to your iPhone, and some recommended resources: Stop, Breathe, Think, Calm, and Headspace. I also recommend logging into the Penn Mindfulness website that has a wealth of resources there. They also have programs all over the Penn sites, and they just started with they offering a program specifically for our stressed teens in high school, which is a really terrific program. And I just might have my daughter check out that program. I also want to mention what a wonderful resource is. I do recommend considering, I'm going off the slide here, of completing an advanced directive. It is a legal document. It can be completed in the luxury of your own home with your family. It's important to have those intimate discussions about medical care and decisions. If you were to ever require a procedure that needs anesthesia, it's at that time an advanced directive is actually activated, and you're allowed to appoint 1 to 3 medical decision makers to be your voice when you're in a procedure. Of course, our focus of care is always directed towards empowering you as a patient and for you to have a very strong voice. But I do want to mention, I think advanced directives are wonderful, and I think it's really important. And I also recommend that they get scanned into your own medical chart and you hand it to all the different valued providers that you're involved in. We are really happy to say that we have now a new cardiac rehab program located at Pennsylvania Hospital, but we also make referrals all over. Every county pretty much has a cardiac rehab program. Cardiac rehab is monitored exercise education program that helps you increase your strength and reduce your cardiac disease and prevent future cardiac risks. It also is an individualized program, a lot of education on focusing on specifically your care needs and increasing your exercise ability. So the disability process and navigating these systems can be very overwhelming. And I can share with you that the team and social workers are here to help guide you through all these intricate systems. Social Security and SSI, or Social Security, is one of the largest federal programs that provide assistance to people with disabilities. Social Security disability, if your physician suddenly says you shouldn't work because of the progression of your medical condition, that process can take about 3 to 6 months to actually have it approved. You must have sufficient work quarters to qualify, as well as meeting their medical disability criteria. The application process is very involved. Certainly, they're asking your full work history, your full medical history. There's a phone interview, and also signing for releases, because they'll gather your medical records for review. Medicare, I know that insurance is most important. Medicare will come 2 years from the date of a Social Security disability approval. If you're actively working full-time, it is important to take a look at what your actual employer offers. They offer a short-term or long-term disability benefit. Sometimes during that open enrollment and actually registering is a great level of protection for you and your family. So all these pieces can happen simultaneously if suddenly you are unable to work. And it's not always has to be something on a permanent level. It could be, just a short-term period. So most of the short-term disability policies through your employer, again, they will guide you on all the rules and regulations, but typically it's around a 6-month process. And then long-term disability, many a times, again, your employer will guide you on all the details, could be as long as you are deemed medically disabled. I know that Dr. Owens talked about transplant, and many of our folks who are actually able to proceed with transplant are able to return back to work and come off of disability within a year post-transplant. Of course, that's all very individualized, but we have a lot of hope, even working with our transplant population. So SSI, or Social Security income, is based on disability of adults and children of limited income and resources. I can share with you that both the Social Security income and Social Security disability programs both have the same medical criteria. Sometimes it's just helpful to have all the answers up front, even if it's 10 years down the road or that you might not be able to work. It's helpful. You can log into the disability system and get answers today of what you're entitled to from your work history and your years of working all that time. Help Hope Live is a wonderful organization that I refer to often. It is a national nonprofit organization offering services for the past 35 years. They are a nonprofit organization, and they do fundraising for unmet medical related expenses, including cell organ transplant, catastrophic injuries, including also heart disease. They are highly recognized for their efficiency and fiscal accountability and commitment to our families. They certainly restore independence and quality of life for thousands. Help Hope Live has provided $140 million of support for medical expenses for families. I encourage you to log on to their website and learn more. The Share Care, there's a Share from Care to Cure. So this organization is building the world's most robust database. Cardiovascular geneticists, research-based cardiologists will be able to expand their knowledge base and research initiatives to develop more targeted, effective approaches for treatment of genetic heart disease. SHARE seeks to educate patients and family members on their scientific findings, advanced in diagnosis, treatment, and management of ACM and DCM. Another special, they have some beautiful family stories, and it's so nice to be able to connect and feel reassured that you are not alone. And so that's another component of this wonderful organization. Please join me. We are, as a Penn Medicine community and American Heart Association, we will be, on November 2nd, we'll be walking for the Philadelphia Heart Walk to fight against heart disease. The Philadelphia Heart Walk is a collaborative nationwide event, and its mission for building healthier lives of cardiovascular disease. We'll be there in thousands with our community, including Penn Medicine. So please join myself and my daughter. My family will be there. I just want to say thank you for the opportunity to share some of the adult resources and tap on just a little bit of just really scratching the surface. There's a lot of support out there, and we'll always, you're not alone. There's a whole team approach to supporting you. Thank you. Have a great day.